When patients go home, it is important to adhere to your doctor's instructions to prevent complications. We use an adhesive dressing that should stay on for at least 7 to 10 days and typically till you follow up with a doctor. It's waterproof and patients are allowed to shower. Remember the precautions that are taught to you by the physical therapist to prevent dislocation and prevent excessive pain. You should be careful navigating around your house because we want to prevent falls. After surgery, patients should avoid certain activities. Number one is posterior hip precautions. You should follow those and avoid breaking them. And they include bending of the hip past 90, crossing of your legs, or internally rotating the leg. These should be avoided. Excessive activity outside of what is required by the physical therapist should also be avoided, at least for the first 3 to 4 weeks, because that can hurt immediately after surgery if you do too much activity.
There's a little higher risk of a dislocation of the hip after surgery, so the first 3 months is critical to allow the structures, the soft tissues around the hip to heal. So half of all dislocations after hip replacement surgery will occur in the first 3 months. And then after that 3-month period, if a patient has been compliant and has healed well, there's a 1% chance long-term of the hip dislocating. Other potential complications are that the hip can wear out as time goes on. Another potential complication of hip replacement surgery long-term is the possibility of an infection developing in the prosthetic hip. And there are things that we do to help prevent that at the time of surgery, and also we make recommendations, appropriate recommendations to patients on what they can do long-term to help prevent that. If a patient suspects that they're having a complication or just feels as though they're not doing well, we want them to call us right away, and we have staff available to see patients. If your surgeon's not available, then someone in our staff should be able to see you in a very timely fashion. So if something doesn't seem right, we just want our patients and expect our patients to call us so that we can deal with it. After surgery, we recommend that patients continue to do the rehabilitation exercises which were taught to them by the physical therapist and which we instruct the patients to do. Basically, we want them to, within a safe range of motion, try to build up the strength and the muscles around their hips so that they're going to be able to walk normally once again, hopefully. So the idea is activity is important, and the correct type of activity is extremely important to help in the rehabilitation and to help provide a good long-term result.
Activities after surgery that are recommended include activities with your physical therapist and exercises that they prescribe for you. You should always remember not to break your posterior hip precautions and remember to do deep breathing exercises taught to you in the hospital.
After the hip replacement surgery, you want to be careful in getting in and out of your car. You want to have your family member prepare the car by pushing the seat all the way back, as well as reclining the back a little bit. You want to make sure that you square yourself off into the passenger seat. You want to sit down, and then you want to swing your legs in. You may need to use your hand to help your operated leg in or out of the car. You want to make sure that on stairs you take them one at a time. You want to lead with your operated leg going up the stairs and your non-operated leg going down the stairs. So in other words, you want to go up with the good and down with the bad. After surgery, you will continue the exercises that you have been doing in the hospital, but you can also increase the number of repetitions or the frequency of the exercises in order to improve your strength.
Following hip replacement surgery, you're placed on total hip precautions, which mean that you're not allowed to bend past 90 degrees at the hip. Therefore, doing things like lower body bathing, lower body dressing, are things that you are unable to do without some assistance. So there are a variety of reaching devices available to help you do these tasks. The first one is a reacher. It's used to put on pants, undergarments, can also be used to hold a shoe in place while you slip your foot in. It's also a device that's utilized to pick up items off the floor that you may have dropped or to retrieve items off of low surfaces. The second device is a sock aid. It's just utilized to put your socks on. The third device is a long-handled shoe horn. It's 24 inches in length, so much longer than your typical shoehorn. And if you have trouble putting your shoes on prior to surgery, you may need this device following, just to assist you with getting your sneakers on or whatever footwear you decide to use. And the last device is a long-handled bath sponge, and it's just used to reach your lower legs below your knees, as those are areas that you're unable to reach while maintaining your hip precautions. Large equipment-wise, after your hip surgery, you're not allowed to go down onto a low standard toilet. So a toilet riser or a commode style device is needed to make your height of your toilet adequate so that you maintain your hip precautions. The other thing that you may or may not need is a shower seat, but we talk to you about that piece of equipment on an individual basis when you come into the hospital. The correct technique for transferring on and off the toilet after a hip replacement is pretty simple. First of all, you want to make sure that you have a riser on your toilet or a commode over your toilet to ensure that it's the proper height for you so that you maintain your total hip precautions. Then you're going to back up to the toilet with your walker. Once you feel it behind your knees, you're going to slide the foot of the operated leg forward and then gently lower yourself down onto the toilet. This ensures that you maintain that 90-degree angle at the hip. Coming back to stand, you're going to push up off the toilet with the operated leg slightly forward and reach for your walker. To safely transport items after surgery at the walker level or at the crutch level, you do need either something placed on your walker, like a walker bag or a walker basket, to transport items in. It's very important to keep both hands on the walker at all times, so one of these pieces of equipment is needed. At the crutch level, you'd have to rely on a shoulder bag or a backpack to transport items safely from room to room, being that both hands always need to be maintained on the crutches.
Recovery time after surgery is variable. It depends on your preoperative condition. If you had arthritis for a long time and you're deconditioned before surgery, it'll take you longer to recover. It depends on whether you had any sort of minor complications after operation, which is rare, but would slow down your recovery. Typical recovery is anywhere from 4 to 6 weeks until you can walk with a cane or no cane at all. And upwards of 3 months for solid pain relief with occasional 1 or 2 pain and basically no pain.
Most patients after surgery will go home on the 2nd or 3rd day after surgery. Patients are going to be happier at home. They're going to do better at home with less chance of a complication if they're able to go straight home. So usually on the 2nd or 3rd day after the surgery, they're ready for that. And we arrange physical therapy for after that, whether it be a physical therapist coming to their home or hopefully them going out to a physical therapist office as soon as possible for a period of time after the surgery. Initially, they're going to be walking with either a walker or crutches for 1 to 3 weeks, and then a cane for another 1 to 3 weeks. So somewhere 2 to 6 weeks of using something to help them walk. After surgery, we expect and hope that patients are able to get back to do things which they have not been able to do for quite a while. We try to avoid long-term running and jumping activities. On the other hand, someone who wants to play golf, someone who wants to ride a bike, someone who wants to swim, do other activities that a otherwise healthy, active adult wants to do and can do, should be able to perform this afterwards, and that's our goal, that's our hope.
If a patient was unable to get to an independent level with their mobility in the hospital, a short-term rehab stay may be indicated, and as a team, we work together in order to get you there.
A patient will be sent to short stay rehab, usually the 3rd day after surgery. In the morning, they will have their breakfast, their vital signs, some blood work. We'll do discharge paperwork. We'll have a physical therapist see the patient, and oftentimes the rehab facilities like them early, so we do try to aim for them getting out around 11 a.m.
The benefits of using a walker is to assist with your mobility. Most patients have some muscle weakness after surgery. They also sometimes have problems putting pressure on their affected side. Most of the time you start out using a walker, you step with your operated leg, followed by your non-operated leg. And we will go over this while you are in the hospital.
Follow-up care after surgery includes a visit to your doctor to make sure that your wound is healing well, and most of the time to remove your staples unless these are removed in rehab.
We will usually take x-rays at that period of time to confirm that the prosthesis is in the exact position that we want it to be in, and further instruct with exercises to be doing and with activities to do going forward.
It will include further follow-ups to make sure that you're strengthening and healing well. And typically for hip replacement, you will need a follow-up between 1 and 5 years to make sure that the hip replacement is functioning well. This is not the type of operation where you have a replacement and you never see the doctor again. You will see the doctor many times over to make sure that the hip is doing well over time.
Longer term, we advise patients to be seen every couple of years for just a routine checkup to make sure something's not going on with the prosthetic hip that they don't realize or that they're not symptomatic from. So early on, several visits with the surgeon afterwards, and going forward over the several years, basically for the rest of a patient's life, we like to see the patient every couple of years to make sure that there's not something going on. If a patient is concerned that their progress is not what they expect, or if they're concerned that they have a potential complication, then we want them and expect them to give us a call so that we can see them back and evaluate them and do whatever other appropriate testing or diagnostic measures are necessary. Basically, if a patient doesn't feel they're doing well, we need to hear from them and we want to hear from them.